What's up, everybody? We are back with another brand new, fresh episode of Wellbeing Wednesday with Matty Wills, of course, brought to you by MetroHealth, where each time we talk to different representatives, doctors of MetroHealth, just about a variety of different things that they have going on. And as we all know, June just kicked off, and June is Pride Month, so that's what we're going with. That's what we're going with today. So without further ado, let's bring in today's guests. We have two of them as a little switch up from our norm. We have Dr. Mark McLoney and then Dr. Kathleen Alto. And I pray I didn't butcher those names. I think I got them down right. But first and foremost, welcome to the show. Thank you so much for taking some time out of your busy schedules. And we really appreciate you being here.
Thanks for having us.
Absolutely, absolutely. So we'll kind of, as we discussed pre-show here, I like to give our viewers and listeners a little context so that we know, or that they know, we didn't just yank you guys in off the streets, and that you are very well-versed in what you do. So Dr. McLoney, we'll start with you. Just tell everybody a little bit about your journey, what your role is within MetroHealth, and then, what exactly you do on the day-to-day.
I will be glad to. So I grew up in a small town west of here called Norwalk, Ohio, known for a virus, stomach virus. My father was a family physician, so I'm a second-generation family physician. Actually had my undergraduate degree in theater arts from Denison University, but then I went on and got a master's in human genetics from the University of Cincinnati. Then I went to the Medical College of Ohio in Toledo, got my MD, went to Altman Hospital in Canton, got my residency, met my husband then in Cleveland, moved to Cleveland, and started in private practice, and was in private practice for about 25 years. I was taking care of a number of transgender individuals because a therapist that was near me was friends. And he goes, I know I can send these patients to you and you don't care anything. You'll just take care of their health. And I'm like, I will do that. And I had a fairly large LGBT population just from being in the community. I happened to be on the cruise for the bowling league of Cleveland, the gay bowling league, and ran into Dr. Henry Ng. And we started talking, and he said, why don't you come to Metro, help us with our Pride clinic, and you can deal with these patients all the time. I'm like, that would be great. So about 8-9 years ago, I came to Metro, joined the Pride clinic, and for the past, oh boy, it's hard with COVID, 3 or 4 years, maybe 5 years, I've been the medical director for Pride.
Wow. So a very well-versed journey. You've been all around Ohio, if I can remember correctly, with your learnings and now just in your professional career. So thank you for that. And then Dr. Alto, what about you?
I love hearing about the history of the Pride Clinic and knowing just that it's only been around for a little under a decade and how much it's grown since then. And there's so many people who have been around from the beginning, and that's really cool. But it's also really cool to see it have so many new people joining, like myself. So I've been at MetroHealth with the Pride Clinic for about a year when they decided they wanted to have a psychologist as part of the team with able to dedicate more time specifically to this community. And when I heard about it from another psychologist that worked at Metro, I was like, oh, you mean you have my dream job available? Yes, I am in fact interested in that. Absolutely. So I got my undergraduate degree from Cornell, and I'm a Northeast Ohio native as well, as born and raised in Akron. So went away to New York for undergrad, and then I came back for graduate school at the University of Akron, and then moved up to Shaker about 2 years ago, and live here with my partner and our 2 kids. So I absolutely love my job at MetroHealth Pride because I get to provide individual therapy for LGBT folks, as well as I'm part of the process of helping people access gender affirming surgery, because it's a medical process, but it does require the participation of a behavioral health expert like myself. And so that's a really enjoyable part of my job. And the patients are great, and my colleagues are great too. I have a bias towards LGBT affirming providers who choose to do this work. I found that they're some of the best doctors that I know. So it's really exciting to be able to work with them.
And we're going to get into, everything that the Pride Clinic is all about. Before we do that, though, I do want to just ask, I know Metro has several campuses. Where exactly is the Pride Clinic located?
Well, we used to be, of course, at McCafferty. and that closed prior to COVID, but everybody thought it was, oh my gosh, something happened. So we have now a network, a Pride network,
Gotcha.
ranging from Cleveland Heights to Brooklyn to Rocky River to Brecksville. We also have our Kids Pride at Middlebrook Heights. And did I forget anything? I think that's pretty it. We've tried to cover the whole city. We have an east, west, and a southern, and a kind of a centralized clinic.
Gotcha.
And we see people from everywhere. There are people who drive hours and hours to come.
Gotcha.
Right.
So then this,
really
so
far.
then this is not something that is an undertaking everywhere then in all hospitals and different clinics. So we're special in that regard.
Yes, we are. In fact, actually, I get a lot of calls from people in the southern part of the state about our care. And I used to have the record for the longest traveling person. I had a person who lived in Atlanta, Georgia, who was a trans patient, and he would come up twice a year to visit his families so we could have our appointments and he can get his meds renewed. And people from Cincinnati will drive past Columbus to come to our clinic because we're well known, and we've got a number of great providers. I mean, I can't say, and Dr. Alto being added was just a cherry on the sundae. I mean, it's just been wonderful.
Good stuff. Good stuff. So before we break into these questions, I do want to, among other things, the Pride Network primary care includes family planning, pregnancy care, chronic disease management, elder care over 55, and care for children, smoking cessation. I'm not exactly sure what that is. Anybody want to?
Smoking it's quitting smoking, quitting tobacco, smoking, vaping.
Fancy way to say that. So they cover all the bases, to say in short. And then, of course, we'll include the contact information here as we wrap up. But Dr. McLoney, we'll start with you here. What is LGBTQ plus healthcare?
Well, as I told a residency program in Akron several years ago, it's basically healthcare, but it's specifically centered on a specific population. There are a lot of issues which Dr. Alto will speak to more for the LGBT plus population. They are very traumatized by a lot of healthcare, misgendering, especially for the transgender, what I refer to as transgender ER syndrome, where, oh, you broke your arm, geez, I wish I could help you, but you're on estrogen. And of course, the lesbian gay population has been an issue for a long time. I have a patient who's from far western Ohio who grew up in a small town, still lives in a small town, saw a doctor when he was born and has seen the doctor every year since he's been growing. But when he started having specific issues related to his coming out of the closet, he sought out a provider that could provide that. I think the big difference for LGBT healthcare that's so important is to making an environment that's very comfortable for people, so that they feel welcome. Even when I was in private practice, I would have a rainbow flag and a planter on my front desk just to let the patients know this was a safe place, right, that they could talk and they could get care. There's some extra stuff. We do PrEP, which is pre-exposure prophylaxis or prevention for HIV treatment. We do the hormones and things like that too. So there's some little extra things, but one of the important things about making a place that's so welcoming and comfortable for LGBT plus or the gender sexual minorities is that they can get the care they get. Unfortunately, a lot of people are afraid to ask for basic stuff or have been traumatized by doctors before for a variety of reasons. One of my big goals is to get emergency room doctors not to just assume. So if somebody comes in saying they were exposed to a sexually transmitted infection and it's a man, not to say, here, pee in this cup, because they may not be using that part of their body for sexual intercourse. So it's the awareness, I think, too, of the providers being either in the community or very much aware of the community, that we know the special constraints and the restrictions and the issues that they have, and just making it more welcoming.
Yeah.
And that's exactly why we have people driving for hours to come see us, is it's not always because they might actually have access to LGBT affirming care or special clinics closer to them. But when you've had so many negative experiences with healthcare providers and you've seen other people in your community have negative experiences with healthcare providers, if you find somebody that you feel safe and protected with, it's people that's really important to people, and it's very special to them. And it can make it very difficult for them to seek care outside of that person, because it's like, this is this person, this community helped me when it feels like no one else will. And that's part of what kind of contributes to some of the health disparities that we'll talk about later. But it's also why people are so loyal, and we'll drive really far for our clinic. And sometimes I'll be like, this is a really long drive. We could probably find something closer to you. And they're like, no, absolutely not.
Right.
I will not switch doctors.
Mm-hmm.
It's interesting because when we started this journey with Metro and having these types of conversations, one of the main focuses of mine was to just kind of bring the awareness to minorities in general. The Black and brown community specifically was probably one of my targets when I started this. But over time, it's just, I don't know what the word is. It's kind of scary, I guess I would say, that so many people are just seeking comfort in healthcare and, so many different things. But as it relates to MetroHealth and doctors, the amount of doctors that I've talked to, whether we're talking about minority women, minority men, whatever it is, we all just want to be comfortable and get accurate treatment, fair treatment and assessment. And, the fact that that's such a underlying theme with so many different groups it's kind of crazy, to be honest.
The medical system and healthcare doesn't have a good history of taking care of marginalized people and of all kinds. And there's a lot of history of them actively perpetuating harms against those groups of people. And so sometimes I get frustrated because people throw up their hands and they're like, why doesn't this marginalized community or this marginalized community, they don't care about their health. Why don't they take care of themselves? Why don't they see the doctor? Why don't they do these things? And it's completely ignoring the role that healthcare has played historically in making us not a safe place. And it's going to take a very long time for healthcare to earn the trust and respect back of the communities that we've hurt.
I will throw a little optimism here. I work with students at Case Western Medical School. And as I was telling Dr. Alto earlier, these kids get it. They realize that a patient is a patient, no matter what color, gender, sexual orientation, anything that they are a patient. And I actually just finished grading some of their personal reflections, and these kids are so on the mark. They get it. A person, doctor was complaining about a non-compliant patient, and they're like, but they didn't ask if they had traveled to get to where they needed to go, or if they had food, or if they had money to buy their, medicines and stuff like that. I'm like, yes, that's good. You're aware of those. And even if it's just in the background, you need to be aware of that. So things are looking good for the future, at least as far as case is concerned.
That is a really good point too, just because, we can kind of see that the younger generation, whether it's because they're exposed to more or it's just talked about at a younger age for them, and so it's not so taboo for them. But there is kind of a shift going on in terms of, whether you want to call it woke or whatever you want to call it, that they're a little bit more aware, you know what I mean, and accepting, and that is a good thing. So I'm glad you pointed that out. Dr. Alto, we'll swing to you to lead this one off. What are the health disparities, mental and physical health, that impact this group of individuals?
So, broadly, when we think about the population of gender and sexual minorities, there are more health disparities, like there are with a lot of oppressed and marginalized populations that you've talked about on your show already, and drawing attention to that. And so when you're looking at on average with this group compared to people who are not LGBT, more likely to be disabled, more likely to have chronic health conditions like hypertension, they're more likely to just describe their health as poor when we do research studies and ask about that. And we see that they're more likely to have mental health problems, substance abuse problems. They're less likely to engage in that preventative healthcare, the things that you need to get done, and like regular cancer screenings, more likely to use tobacco. So that's kind of looking at it big picture. You see all these health disparities. But also, I think it's really important to not just talk about the big picture, because, LGBT has a lot of letters in it for a reason. And there are different health disparities for different groups, and those different populations within the LGBT community have unique health disparities and have unique healthcare needs. So for example, like if you look at bisexual people, especially bisexual women, have higher rates of sexual violence and exposure to some sexual health risks and domestic violence risks that are important to address. And men who have sex with men might have sexual health needs, sexual screening needs, like, for example, when we had monkeypox, and the Pride Clinic was doing a lot of work around getting people access to the monkeypox vaccinations. And when you think about the LGBT population and their unique healthcare needs, people often do jump to thinking about STIs and thinking about HIV. And those are really important things for this population. What I think is interesting is these are also really important things for everyone.
Right.
And sometimes there's actually some really interesting research that says this population gets better sexual health care because their providers, when they're seeing gender affirming and LGBT affirming providers, they talk to their providers about sex. And straight people and cis people might be less likely to do that, and actually less likely then to get the care that they need. But there's also this idea of the health disparities. And I think it's really important to, where do they come from? Like we talked about before, does it come from, are people just not taking care of themselves or not caring about these things? Or does it come more from people being concerned about where can I go and how will I be treated? And that smaller decisions over time, deciding not to go to a primary care doctor, not having access to a primary care doctor, not having access to health insurance, will add up to some of these health disparities at the end, where we look at, okay, people are more sick in this population. Why is that? And, I think historically we've really focused on what are these people doing that leads to them being more sick, instead of what is healthcare doing or not doing, and what is our, country and our community doing or not doing.
It's a large issue. And one of the things that Dr. Alto brought up, I had a patient once who had been to the emergency room because she had been beaten up by her girlfriend. And the emergency room doctor said, oh, well, this, you can't say that was assault or domestic abuse because you're both women. Mm. It's like assault is assault. That is a pretty simple thing that should have been addressed. And I do have a couple that are patients of mine that actually I knew beforehand. And they came to see me because when they went in to see the previous provider, he said, so who are you guys? And they're like, well, we're husband and husband. And we got married. And he goes, oh, you guys can't get married. And just dismissed them like right off the bat. And so I'm like, oh my God. I always tell my students at Case, listen to the patients. The patients will tell you what they need, more than you'll ever be able to diagnose, and work with them on that, because that's how you'll learn. And it's, again, that going back to the comfortable space, if patients feel comfortable, they'll tell you what the issues are that they have, and are more likely to let you know, yeah, I'm smoking, I'm drinking, I'm using drugs, and you're able to more likely help them get the preventative care that they need. And that's what
I think a really great example that we see that is when you're working with this community, you can understand it and see it, and it's pretty obvious. But if you're not working with this community, you might not be able to draw those connections. Are when we see that trans people might be more behind on cancer screenings. They're not getting their cancer screenings done. And then when you're working with this community, it's like, oh yeah, a lot of trans men don't feel comfortable going to an OBGYN that tends to really focus on this idea of like, this is women's health, this is a women's cancer screening, and we are dealing with this part of your body that might have a lot of discomfort for a trans man. And this leads to being behind on those and not getting those cancer screenings done. And again, when you work with this community, you're aware of that and are able to talk to patients about it and talk to them, getting them connected. That's one of the great things about the Pride Network, to providers who will be more affirming. But if you weren't aware of that, you would just be like, my gosh, why aren't you, you're supposed to get your pap smear done. Why didn't you get it done? Right. And just completely missing this big picture. And I think that's what's really important about that awareness is knowing what might be going on for people when they're not getting something like that done.
And that's something else I like to piggyback on. Besides our preventative primary care doctors, we have a lot of specialists at Metro that are very pride friendly. So we do have people that we can send in trans men for their front or pap smears. that do it all day long and are familiar with the issues that are related to that. And so we can get them the care that they need. But understanding why there may be a delay, I had a cis patient actually recently who had some anal fissures. And when he went to the emergency room, they kept harboring, why haven't you got your colonoscopy yet? Well, he was sexually assaulted as a child. So that type of an exam was very traumatic for him.
Right.
But they just blew him off. And fortunately, he saw one of our other providers that I use a lot with our Pride people, who's like, oh my gosh, we'll worry about that later. Let's get this taken care of.
Exactly.
And then we can talk about it. It's that little bit of inside knowledge that you have with these patients, our providers have, and that I think really helps get rid of some of the disparities. Not a lot, but all.
Go ahead, Ms. Alto. I know you want to say something.
I was just going to say, I think that's a great example of trauma-informed care too. So that's the idea of providing healthcare that acknowledges the fact that trauma is incredibly common in humans,
Right.
the population generally, and especially even more prevalent among marginalized populations, including LGBT people, and especially for trans people. It is rare for me to do a mental health assessment and have no trauma history present whatsoever. And because of that, you need healthcare that is aware of the fact that trauma happens and is adjusting their treatment to that. And I think that that's part of competent care for everybody, and especially for providing care for this population is being what we call trauma informed.
Yeah, and the trauma is something that I was just going to mention. It would almost seem impossible, just me as a person, if I'm going to see somebody for whatever reason, healthcare specialist for whatever, and the first thing they're doing is grilling me about X, Y, Z, and ultimately not providing me what I need or what I think I need. It would be traumatic. It would take me a little extra nudge next time that I need to go see somebody to actually go and do it. So, I mean, that just speaks to why what you guys are doing is so special, because it is so necessary, but it's also kind of sad in the sense that we need to go this route just to provide effective healthcare for everyone. So it's a lot, man. Having these kinds of conversations is always eye-opening to me, because I always learn something that or gain a different perspective that I didn't have going into them. So that's why I like doing these kinds of talks. But we'll keep it moving here. I'll get off my soapbox. Dr. Alto, this is for you. How much does discrimination, lack of access, minority stress, and institutional mistrust affect people getting care?
And I think this we've touched on a lot of this already, is that those are the causes of the health disparities. Primarily, it's transphobia and homophobia. So the negative attitudes and bias we have towards these populations is what is making them sick. So that can be because of discrimination. The minority stress theory has a lot of research to support it. And it's this idea of experiencing discrimination, fear of discrimination, leads to physical and mental health outcomes. It's hard on your body. It's hard on your brain. It makes it more likely for you to experience mental health and physical health problems like hypertension or depression. And so for this population, those experiences, living in a world, living with a family that's not accepting, experiencing trauma because of that, right? If you are victimized because of your identity, if you are isolated because of your identity, that has direct consequences on your mental health and your physical health. And then even beyond that, there's the access to healthcare issue. So on one level, literally access to healthcare. You are less likely to have access to healthcare if you're less likely to have access to a job, and this population is more likely to have difficulty accessing a job and employment because of bias and discrimination.
Right.
And then even when you can access healthcare, like we've talked about repeatedly already, there's a 2015 survey, I think it's called the US Trans Health Survey, that asks just about experiences of discrimination with healthcare, experiences of feeling invalidated. And the numbers are just really shockingly high. It's very normal to have that experience with healthcare, which leads, exactly like you said, to avoidance of healthcare. So when they ask, how often do you avoid engaging with healthcare? because of those past experiences. Again, you're seeing really high answers among trans folks in particular. And all of those things add up into poor overall health outcomes. Right. And so some of those things are about, obviously experiencing a hate crime, not going to be great for your physical and mental health, right. But even reading about the hate crimes that are happening to other people who have similar identities to you can also lead to poor health outcomes and make it, people all the time tell me they're just afraid to leave their house. Mm-hmm. Afraid to leave their house because of what's going to happen to me. Now, if you're afraid to leave your house, you're going to be more isolated. You're not going to get your health care. You might not go to the grocery store to get healthy food. There's just so many outcomes that kind of cascade down from, I don't even feel comfortable existing in public as a trans person because of the things that I've read or the things that I've seen or the things that I've been told. And you see all of that trickle down with our population to leading to these, big picture health disparities of being less mentally and physically healthy on average compared to people who don't have these identities. I will say that, I think it's really important to raise awareness of health disparities. I also want to give a shout out to resilience and strength among this population, like a lot of oppressed populations. The show of community and the amount of strength that people do have and the ability to overcome obstacles is truly incredible to witness.
It really is. One of the things that Dr. Alto alluded to earlier, which is, I think, it's a well-meaning, maybe microaggression, but it's a well-meaning misstep, is if a gay man goes to a doctor, they kind of emphasize STIs. But they may forget, your blood pressure is high. We need to check for sugar. We have to do all these other things. And that's what's important. And if you walk into a doctor and the first thing they start asking you, grilling you about is, how many partners have you had? Have you had any STDs or anything like that? You're going to like, I'm here for my blood pressure. Right. You probably would not go back to that person again. and that's part of, I think, why this population is so underserved in that regard. Because they have been not disrespected, but they've almost been like ignored when they see their doctors, right? What their real reasons are, and
mental health professionals too. Like, I didn't talk about that, but there's a lot of transphobic and homophobic behavioral health providers as well that people have had negative experiences with, and it can make it really scary for them to reach out for help related to their mental health. Yeah. And that's why we need more people who are comfortable and affirming working with this population, so that, homosexuality used to be listed in the DSM, which is the kind of Bible for psychiatric disorders, as a disorder. Mm-hmm. So the field has a long history of seeing people with different sexual orientations as being sick. And some of that might still exist today for some providers. So people get very nervous in their first meetings with me. They're like, I don't know about this. I just, I do not know about this. And I think it's really important to be like, I get it. That's completely understandable. Like, of course you have concerns about whether or not I'm going to be a trustworthy person.